Hello, this is Dr. Gay from First Look MRI, and this is a 31-year-old female who complains of pain and swelling in her anterior left hip and thigh. And on her MRI scan here, she has extensive edema and swelling throughout the muscles in the front of the hip and thigh. All this white stuff here is just infiltration and swelling within the muscles. Some funny round areas here. If we look on the short axis views, the axial views, we see the process over here. It looks ill-defined, irregular, heterogeneous signal. So this looks really worrisome for malignancy. Soft tissue sarcomas can look just like this. Her femur, though, is relatively unaffected, which is unusual. If we look on this view here, we see the bone looks nice and smooth. There's no invasion of the bone. And there's one other finding here that helps us. There's a little line here going around. This is a benign appearance of the bone. There's the cortex, which is around the rim, and this is some periosteal new bone over the top, but instead of being irregular, it is very smooth, has a kind of a thick wall, or a thick margin rather. So this looks more of a benign bony appearance, even though there's this really prominent, more aggressive soft tissue component. So we did x-rays, and x-rays oftentimes aren't very helpful, but in this case they're very helpful, because they show this ossification here of the soft tissues. It's very smooth and clean. It's not irregular. The pieces of bone are, have well-defined margins. You can draw a pin around. So this looks like more of a benign appearance. And with that, we think this may be something called myositis ossificans. When there's an injury, the muscle can tear and bleed, and then when that does, the body will respond by having this really prominent inflammatory response and also ossification. It'll ossify the blood products and muscle. And so this is what this looks like it is. And because the x-ray looked benign, we decided to follow this to see if it evolved, and it sure did. So here's the newer one, and it looks way, way better. I'll put the old one up here again to show the difference. There it was. And again, several months later now, significantly improved. And this area here is where it has gone on to ossify. And lastly, I'll show you the x-rays now as compared to before. This is the original x-ray here in May. And this is 3 months later, so that soft tissue injury has gone on to ossify, and again, it has well-defined margins, pathognomonic for myositis ossificans. Thank you very much.